Does it really matter if it's, October or December? Does it matter to the safety of it? Have we heard really from regulators, when they're expecting it without rushing it?
Yeah, I think that's a great question. So the first and foremost is, trials are enrolling quickly. That doesn't mean that we have the full signals we need to determine safety. Clearly, we've had the AstraZeneca vaccine out of Oxford that was stopped and halted early. It's now resumed in the UK. It has not resumed in the United States yet through further safety reviews. But in that case, there was a case of a patient with a transverse myelitis and really an inflammation of the spine. And we don't know yet whether or not it was related to vaccine. We don't think so. But that's the kind of reviews that have to go on and have to be thoroughly vetted. And so, for example, that vaccine in its review will take over a month likely in the United States to go through a full vetting. So it all depends on the safety profiles that we see and the signals that we see within the vaccine participants.
Jason, are you comfortable that when a vaccine will be available, it will be 100% safe? And unless we have that, how many people won't want to be vaccinated?
Well, I think it's really important that there's very little that we ingest that is 100% without side effects. So if you think about it this way, if you take in too much water, that increases the amount that you really need to go to the bathroom, right? So everything has some level of negative impact if taken, in the wrong way or in the wrong dose or in the wrong structure. So vaccine safety is no really different than in that regard. We just need the data. We need to understand. Flu vaccine, for example, causes many people to have, a sore arm. It causes them to have slight temperature elevations, and that's, in no way a live virus vaccine. And many of the vaccines we're currently trialing for coronavirus, they have some portion of a real virus in them that are used to put the proteins into your body, and which can cause those same muscle aches, fevers, chills in some participants. So it's not, I don't think, on the scientist's mind to have a fully symptom-free vaccine. That's just generally not the way it works. But we want to eliminate and reduce those possibilities as much as possible and surely have long-term follow-up on people to know when we say to people, here's the potential side effects after dose 1 or dose 2, as the case may be for different vaccines, so people know what to expect, and we can provide them anticipatory guidance.